Hi, I'm Dr. Blair Masters with Arkansas Physical Health and Rehab, and I wanted to talk to you today about a subject that is important to all of us, really, and that is long COVID. You know, COVID is kind of resurging here lately, and that is really a concern to healthcare providers, but it should be kind of a concern to everybody for sure. And there's so many things you can do about it, but one of the things that makes me so heartbroken is these people who come in with long COVID, and COVID's been around long enough to where they've really studied it. They've really put some research into it. And here's some key findings of a recent study. 22 million US adults, that's just in the United States, are living with what they consider long COVID. That's about 7% of the US population. 7 million are experiencing disabling long COVID, and that's like 2.3% of the population. That's a huge amount of people disabled in a very short period of time. As of January of this year, the cumulative cost of long COVID is estimated to be about $386 billion. Really a huge amount of money. So what's long COVID? What is that? Well, here is what it is. Tiredness and fatigue, difficulty thinking or concentrating. Some people call it kind of brain fog, shortness of breath, headaches, dizziness, especially when you stand up, and then fast beating or pounding heart, like heart palpitations. And then chest pain, cough, joint and muscle pain, depression, anxiety, fever, and the classic loss of taste or smell. As long-lasting symptoms, these happen even in people who never even went to the hospital. So this isn't just for those who spent months in the hospital or something like that. This was a study that was done, and this was observed at 4 months and 7 months post-infection. Disabling long COVID is a whole other story, and this is a sharp decrease in overall health that went along with the COVID infection and can last more than a year. Some people have had strokes related to this, heart attacks, and some have even become diabetic. And weeks of treatment in intensive care can mean that a person never ever returns to their previous health. Let alone, this doesn't even consider the financial burden that people have when they're in the hospital. It can affect your brain, your heart, your lungs. It can just be really, really hard on you. So what can you do about it? What's the solution? And I really hate to tell you this, but if you've been coming to me as a patient, this is kind of what I tell people on a lot of health problems. There's no simple solution. There's no magic bullet, and I'm really sorry, but there isn't. You have to work on keeping yourself healthy. Making sure you take vitamins. Getting a good diet is great, but it's not enough. You know, our soil is so depleted, even if you eat lots of vegetables, you're not getting enough minerals. Eating lots and lots of vegetables, having a really good diet that's low inflammatory. I recommend people decrease grain-based foods. And then I talked about supplementation, supplementing with vitamin D on a regular basis. That really, really helps your immune system. Make sure that next time you get a blood test, you check your vitamin D level, have your doctor check it, or we can check it here if you come in for blood here. Be sure that you're taking probiotics. Probiotics are a situation. They really help your gut, but they make your immune system work so much better. And then getting chiropractic care on a regular basis. They've done lots of studies on when you get regular chiropractic care, once a month, once every 3 months, depending on the person. Some people more frequently than that, but this makes a significant difference in your immune system. They've done studies on this and checked people's blood post adjustment and also long term. And they found that getting in chiropractic care on a regular basis really boosts the immune system. So be careful of long COVID. Don't put yourself in a situation where you're likely to get that. And we're here to help you every step of the way. If you have any questions, call the office. Thanks very much.